Okay. Hi, my name's Brenna. I'm going to be your nurse today and doing your exam. Could you tell me your full name and date of birth?
Joanne Plesner Estes. My date of birth is 3/25/1973.
Okay. What brings you into the clinic today?
I'm just getting a physical for a new job.
Okay, great. Are you having any pain today?
No?
Any muscular pain, joint pain, anything like that? Okay.
Nope.
Any current injury or wounds that I need to know about?
Nope.
Okay. Any recent illness like fever, chills, nausea, vomiting, anything
Nope.
like that? Okay. So do you have any food allergies, medication allergies, anything like that?
I'm allergic to vinyl.
Vinyl?
Right.
Okay.
Like vinyl band-aids and stuff.
And no medication allergy, right?
No.
Okay, that you're aware of. How about environmental allergies, like, like hay fever and that?
Yes, I
kind of
do
thing?
have allergies for like pollen and like pine and things like that.
Do you take anything for that?
Yes, I take Claritin
Okay, how often do you take it and how much?
every day, and it's a 0.5 milligrams or something.
Okay,
like that.
every day, okay. And that's through the whole year or just during the summer?
Through the whole year.
Okay, all right, sounds good. Have you had any surgical procedures in the past?
I had my tubes cut.
Your tubes, okay. What year was that?
2007.
Okay. How about, have you been diagnosed with any medical conditions?
No.
No. Are you married?
Yes.
Do you live at home with your husband?
Yes.
Do you live with anyone else?
I have two of my 3 children is there.
Okay. Do you have any current stressors that are bothering you right now?
No.
No. What's your food intake? Do you have like a regular diet? And, what do you normally do on a daily basis?
Yes, I do eat 3 meals a day, if not a little bit more.
Okay. Do you include fruits and vegetables and that
Yes,
kind of
I do.
thing? Okay, great. How about your caffeine intake? Do you drink caffeine?
Yes, I drink about 20 ounces a day.
20 ounces? Okay, is that in coffee form or
Yes,
energy drink?
coffee.
Okay. How about illicit drug use? Do you use any recreational drugs? No. Alcohol intake?
No.
Not at all. Okay, great. Tobacco use?
No.
Smoker?
No.
History of smoking?
No.
Are you exposed to secondhand smoke?
No.
Okay. I'm going to talk a little bit about your family history.
Okay.
Do you have, how about your mother's health? Does she have any diagnoses we should be aware of?
No, I think she's borderline diabetic, but that's about it.
Okay, and your father's health?
He's diabetic and then he has hemochromatosis.
Okay. How about your paternal grandparents?
One had breast cancer and then the other ones were fine.
Okay. Maternal grandparents?
They're fine.
They're fine? Okay. For any of those issues that you mentioned, have you ever had to be worked up for any of those?
I had diabetes when I was pregnant with my last son.
Okay, during pregnancy and
Yeah.
then afterwards it was resolved?
Yep.
Okay, great. Family history of obesity?
No.
History of any type of substance abuse?
A couple of my brothers had drug issues, yes.
Okay. Let's see, are you up to date on all of your immunizations?
Yep.
Have you had a flu shot this year?
Yes, I did.
Okay. Do you take any prescription medications?
Yes, I take thyroid medicine and a antidepressant.
Can you tell me what those are and then the milligram and how often you take them?
I take both every day, and then I take my thyroid medicine is an 88 milligram, and then my so it starts with an S. I don't know the name of it. I take 100 milligrams at night.
Okay. Let's see. Any over-the-counter medications?
Just Claritin.
The Claritin? Okay, no ibuprofen or anything like that?
I do take ibuprofen. Yes.
Okay.
Not very often though.
Okay.
Maybe once every 2 or 3 weeks.
If you did take it, how many milligrams do you take it?
200.
And what do you take it for?
Migraines.
Migraines, okay. Any vitamins? Do you take any vitamins?
I take a multivitamin and I take a B complex.
Okay, like once daily?
Yes.
Okay, and how about any herbal supplements?
No.
Okay. Let's see. Are you having any recent weight gain or unintended weight loss, even though you haven't changed your diet?
I have weight gain, but that's menopause.
Okay. Any cancer history in your family?
Not my grandmother has it, but I don't have it.
Okay. Okay. Do you feel safe where you live?
Yes.
Do you feel that you have been verbally or physically abused in the last year?
No.
Do you feel depressed?
Well, yeah, I'm on depressive medicine.
Okay. So on a daily basis with that medication, do you feel depressed?
No, I'm okay.
Okay. Do you feel anxious?
No.
No. Do you feel like you have feelings of hurting yourself or others?
Nope.
Okay. Do you feel like you have access to health care?
Yes.
That you can afford the health care that you have?
Yes.
You feel like you can afford your medications that
Yes.
you're taking?
Yes.
Okay. What's your level of education?
I have associate's degree.
Okay. And then where do you work currently?
I work at a hospital.
Okay. I'm going to give you a couple of words and I'd like you to just tell me how they are alike.
Okay.
So ocean, lake, and puddle.
Water.
Okay. And then I want you to remember the next three words: ball, apple, and sun.
Okay.
Ball, apple, and sun. So the first thing I want to do is just have you take your right index finger and touch it to your nose. Okay? And then do the same with your left. Perfect. And if you could take your right shin and take your right foot and move it down your left shin. So just like this. There you go. And then do the opposite. Perfect. Perfect. Okay. And then can you remember those three words that I just gave you?
Ball, apple, and sun.
Perfect. So I think what we're going to do now is move into a head-to-toe assessment. We're just going to start with your head and then move down. I might ask you a few questions while we go. So I'll have you just lay back in the bed while we do that. So I'm just going to use some hand sanitizer, make sure my hands are nice and clean, and then I'll put some gloves on here. We're going to start with your head. Good. And as I go through this assessment, I'm just going to check your skin, make sure there's no abnormalities or masses or skin rashes that we're looking for, just to make sure we're not missing anything.
Okay.
So I'm going to take a look at your head here. I'm just going to palpate, make sure there aren't any masses or lesions or excessive hair loss or anything like that. Any pain in your head?
No.
Okay, perfect. I'm going to take this little Q-tip here, and I want you to close your eyes, and I'm going to do an assessment on how your feeling is in your face.
Okay.
So I'd like you to close your eyes, and you just tell me if it's a dull or soft sensation.
Okay.
Okay, so, here we go.
Soft. My barely feels. Has more.
There?
Soft.
Okay. Perfect.
Soft.
All right, perfect. So I'm going to go ahead and just take a peek at your eyes.
Okay.
Okay. I just want you to look straight forward, and I'm just going to make sure your pupils are reactive to light. Okay.
Okay.
Let's see. All right. Look straight ahead. Perfect. Okay. Her pupils are equal and reactive to light. At this point, we could initiate a vision exam. And I'd also want to look towards the back of your eyes, make sure there aren't any hemorrhages, or making sure that the discs are very clear and if there was an issue, then I could refer you to an ophthalmologist.
Okay.
But I see that you wear glasses, so do you see an eye doctor regularly?
Yep.
Okay, so I would continue to see an eye doctor. How often do you see your doctor?
Eye doctor about every 2 years.
Every 2 years?
Unless something
That's pretty
happens and then I
normal
go
for
in.
you? Okay, I'd recommend continuing to follow up to see him. So I'm gonna go ahead and take a look inside your ears. I have a little otoscope here that I'm gonna use. Any problems with your hearing? Okay. At this point, we could do a Rhino-Weber test with some tuning forks that would help us ascertain your hearing on both sides, that if they were equal. But right now, I'm just going to take a peek.
Okay.
So, okay. And I'm looking on the outside of your ear. Your ear looks normal. No issues on the outside. Looking on the inside. Nice pearly gray membrane, no issues on that side. I'm going to come around the other side and take a peek. Outside looks normal, has some piercings, nice pearly gray, no issues on the outside, looks very good. Any past history with your hearing?
No.
Okay. Sounds good. So I'm going to take a look in your nasal passages.
Okay.
Any issues with your sinuses or drainage or anything like that in the past? Any breakage of your nose?
No.
No? Okay. Okay, nasal passage doesn't have any drainage at all, but the mucous membranes are nice and moist. No issues there. So at this point, I would like to go ahead and listen to your lungs.
Okay.
Oh, you know what? I need to look inside your mouth first. I apologize. So let's go ahead and if you could open your mouth and say ah while you stick out your tongue. Okay, perfect. Any issues with your teeth? Okay, any implants with your teeth?
I have one back here.
Okay.
What is that? I don't know.
Okay. It's giving you any
Root canal.
root
No.
canal? Not giving you any issues?
No.
Any problems with chewing?
No.
Okay. Any problems with swallowing?
No.
Okay. When I was looking in your mouth, I was looking for some inflammation in the back of your throat, looking at your tonsils, making sure everything looked nice. Didn't have any signs of infection or inflammation back there. So I think the next thing we're gonna do, I'm gonna have you sit up, okay? The next thing I wanna do is kind of look at your neck here. I don't see any venous distension. Any problems with thyroid issues in your history?
Just for the medicine I take.
Okay. No history of having like a goiter or anything?
No.
Okay, so you feel like it's been effective? Okay, so I'm just going to palpate also since I'm here for your lymph nodes here. And I'm going to palpate here. Okay, very good. I'm going to have you lay back just for a moment. And I'm going to feel here too, just for some lymph nodes. Okay, the only time we would really feel for those is if you're having an illness currently, but they're not palpable at this time. So that's good to know. So you said, you know, you're chewing okay and you're swallowing okay and liquids go down okay?
Yeah.
Okay, no coughing or anything
No.
like that? Okay, so I'm gonna have you sit up once more.
Okay.
I'm gonna listen to your lungs. Okay, and just do a deep breath in and out. Very good. Any history of lung issues?
No.
Asthma?
No.
Wheezing?
Nope.
Okay. I'm going to do this again, and then if you could just repeat 99 as you breathe in and out. 99.
You want me to say 99?
Yep, say 99.
99.
Very good.
99.
Perfect.
99. 99. 99. 99. 99. 99.
Okay, I'm going to listen to the front here. Do the same thing.
99. 99.
Perfect. So next at this point in our assessment, we would do normally a breast exam, but we're going to defer that for today. Do you see an OB regularly?
Yes.
Okay. Do you do a monthly breast exam on your own?
No.
Okay. So what I can do is I can send you home with some instructions on how to do your own monthly assessment on yourself, that you know what to do at home. And if you were to find an irregularity, then you could let your doctor know at that point.
Okay.
So at this time, I'm going to take a look at your belly. I'm just going to take a listen first, and then we'll go from there, okay? Any issues with your belly?
No.
Any pain, discomfort, anything like that?
No.
Okay. Take a listen. Are you having regular bowel movements?
Yes.
Are they normal appearing? Are they loose?
No.
Okay, normal. How often would you say you had a bowel movement?
Once a day.
Is that normal for you?
Yeah.
Okay. Any like heartburn or GERD or anything like that?
Yeah.
Yeah. Okay. Do you take anything for the heartburn?
Antacids.
Antacids?
Yeah.
Okay, how often a day would you say?
It's just when needed.
Okay, is it like Tums or?
Yes, it's the little, it's
Yeah.
close.
Okay, so about once a day you take that? Is it
Maybe, yeah.
Okay, okay. I'm gonna go ahead and listen to your heart while I'm here, okay? Any history or problems with like feeling of chest pain, tightness, anything like that? Okay. Listen up to the side here. Okay, perfect. Okay. Any history in your family with like irritable bowel or anything like that? Okay. So I'm just gonna lightly palpate your belly. If anything does hurt, please let me know. But what I'm looking for is feeling any masses or irregularities while I go through, okay? So but just let me know if anything hurts. So this is gonna be light, it might tickle a little bit, okay? Okay, good. So this next part, I'm gonna do a little bit deeper palpation, and I'd like you to take a deep breath and out when I push in, okay? We're gonna do the same thing for quadrants, okay? So deep breath in and out. Deep breath in, out. Deep breath in, out. Deep breath in, out. Any pain or anything?
No.
Okay, great. So I'm gonna take a look at your arms here. I'm looking at your skin. I'm gonna check for pulses while I'm here. Perfect. I'm gonna check your other arm. Pulses, very good. I'm gonna check your calf refill. Your skin is nice and warm and dry. Fingers are good. I'm gonna check under your knees here for pulses. Very good. Have you noticed any edema or anything in your legs?
No.
Okay. Alright, I'm gonna check your pulses. And you've got socks on, but I would check your calf refill and your toes as well. So next, I'm just gonna have you swing your legs over that way, and we're gonna sit up. And I'm just gonna check your sensation in your extremities. So if you could close your eyes, and then just let me know if the touch is gonna be dull or soft. Okay. So here we go. So. 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 Okay. And this is gonna be sharp or soft?
Soft. 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 Soft.
Okay, I'm gonna do your lower legs, okay?
Sharp. 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 Soft.
Perfect. Okay, so we're gonna do some range of motion. I kind of want to see your strength in this. So what I want you to do, shrug your shoulders like this. I'm gonna come around the back side and try to push down, but
Okay.
don't let me. Okay? Okay, go ahead and shrug your shoulders. Okay, I'm gonna push down and don't let me. Very good, very good. Okay, I'm gonna have you hold your arms straight out like this. I'm gonna push down, don't let me.
Okay.
I'm gonna push up, don't let me. Very good. We're gonna do the same thing with your legs. I'd like you to push legs out. I'm gonna push down. I'm gonna push up, don't let me. Okay. We're gonna do the same thing for your feet. So you can relax your legs, but I'm gonna have you put your feet straight out like that. I'm gonna push down, don't let me. Very good. I'm gonna push up, don't let me. Okay, perfect. So, do you have any questions for me today from this exam?
No?
Okay. We went through a whole physical with you, and I think the only things that we'd want to keep up with were, regularly seeing your eye doctor. We'd want to do a yearly exam with your provider, make sure everything's going okay, checking up on those areas where your family had a past history of some health issues, making sure that you're not also developing those as well. Seeing the eye doctor, and then I think I forgot to ask you if you were seeing a regular dentist.
Yes, every 6 months.
Okay, wonderful, for cleanings and that kind of thing.
Yeah.
Yeah, so just reach out to me if there's any issues that you come across in the meantime as far as your health goes.
All right.
But thank you very much for coming to see me.
Thank you.